Hello everyone, good afternoon and good evening as well.
Good evening, Dr. Zahid.
Hello, hi Dr. Ashish, good evening, how are you? Welcome.
Good evening, fine. Yeah, fine. I'm doing fine.
So today we are doing a quick webinar on ethics and difficult colleagues or difficult conversation. Okay, we'll just wait for few more minutes for some other candidates to join and then we can start.
Sure,
Uh,
sure.
I think we have our volunteers, some of our students, they volunteered. I think it's Dr. Sabia, Dr. Zahra and Dr. Raja.
Yes, I'm here, Dr. Subbosachi. Hello. Good
I
evening,
think,
Dr. Jay.
hey Dr. Sabiashi, how are you? Good evening.
Yeah, I'm fine. Thank you. Thank you.
Okay, so I think all of you are here. So who want to do first so that we can start that accordingly?
Yeah, I can do. I can initiate.
Dr. Zahid, though I have not given any choices, but I will definitely perform. You
Yeah,
give
sure,
me a chance
definitely.
to perform. Sure, sure.
Definitely. Yes, yes, sure. Okay, so ethics and difficult colleague or difficult conversation, everyone had these topics because there is no definite answer or definite solution to this kind of communication. It can go anywhere around. So it depends all on the day that how the role player is or how the patient is in real life and how you communicate with them. So practically speaking, there is no definitive answer for ethics scenarios. It is all dependent on the on your day, good your day or how bad your day is. So whatever your performance is in ethics, don't be disheartened because you don't know how the examiner will mark you for that, because these are the most difficult scenarios. And I think every one of us, we keep on praying that such scenario should not come in the exam, but they might come in the exam and you need to be ready for them. So the first scenario this that I have chosen, so you want to Dr. Sabir, yeah?
Yeah, I can do it.
So yeah, so you can see the screen, yes?
Yeah, it's small. Just a second. Yeah, I can see it.
Yeah. So this is your scenario. Yeah, you can read it and I can give you
Okay.
your preparation time. You can prepare it and then we can start it.
Okay. Please let me know when my time is finished. Okay, Dr. Jain.
Yeah, yeah, sure. You can take your time.
Okay.
Started your timer.
Okay.
So yeah,
Okay.
yeah. Okay.
Okay.
Yeah.
Okay. Uh, Good evening. I'm I'm Dr. Mrcpch-Clinical. I'm one of the baby doctor of this hospital. So, am I talking to Mr. Kalbright?
Yes, doctor. Yes, it's me, Bride. Yeah.
Okay. So, Mrs. Kalbright also here. So, it's nice to meet you. So, is it good time to talk
Yes.
regarding the further course of plan, management plan?
Yes, definitely, doctor. Yeah, definitely. Yes.
Okay. So, Mr. Kalbright and Mrs. Kalbright, first of all, I just want to know how are you doing, Mrs. Kalbright?
I'm feeling a bit stressed up, but I'm better now. After they give me
Okay.
some injection, I'm feeling a bit better. Yeah.
Okay. And before I start off, just I wanted to know that how much have you been told about your pregnancy status?
Well, the midwife, she was telling me that I might be delivering sooner,
Mm-hmm.
like might be today or it might be tomorrow. So we are quite concerned that yeah, uh,
Mm-hmm.
what, yeah, what will happen and what we want to do actually. So that's why we asked her to ask some of from the
Mm.
team of doctor to come and talk to us.
Okay.
Yeah.
Okay. So that's why I'm here. So first of all, I just want to know that you have already been told that you are right now 26 weeks of pregnancy. So do you have any idea that about preterm or premature babies?
Like what I have searched from the Google, like these
Mm-hmm.
babies are very small and they can have a lot of complication. And the most difficult part is like if the everything goes not what is as expected, so there might be a CP child in the future. So what we actually don't want for to have a child who is CP in the future, because I remember that one of
Okay.
our neighbor, they had a
Mm.
preterm baby and that baby CP as
Okay.
well. So I have just read from the Google, so that's our main concern. That's why we don't want our baby to be restricted.
Okay. Look, Mr. Cobright, first of all, yes, I can understand it's a very stressful time for you. But at the same time, I can tell you in brief, because yes, you are absolutely right that the child is, as we all already know, that the child is premature and well premature, because we call anything pregnancy less than 37 weeks premature. So at right now, the baby is only 26 weeks. You can understand. Are you with me, Mr.
Yes, yes,
Kirkbride?
doctor. Yeah, yes.
So few of the things are there. First of all, already Mrs. Kirkbride received doses of steroid, that betamethasone drug, as you mentioned earlier, that she
Yeah,
received that dose. It's
yes.
a good thing. First of all, it's a good thing for uh, development. If you think about the development of our lungs, that breathing machine, it develops well. So that's a good thing. Second
Okay.
thing is that some of the medicine that is called magnesium sulfate, it's already running. So it's also good. It's also good for the maturity of brain and many other organs. So yes, you are absolutely right that right now the child is very premature, but we have some hope. It's not like that we don't see any light at the end of the tunnel, but we have hope. Okay, so
Yeah, I can
tell
understand you.
me, what do you think?
You have hope, but like as you said, the baby is very premature and he will be
Hmm.
baby will be small as well. So he will be
Hmm.
staying if in case we agree for you to do everything for the baby. So he will be
Hmm.
definitely admitted to your unit and he will be staying with you. And during the stay, he might have complications which we are afraid
Hmm.
of. And in the end, we will be suffering from all these things which we don't want. So yeah, we will
Hmm.
go with like, not to do anything for the baby. That's what we have decided. Me and my partner, we have
Yes,
decided that we are not going to do anything for the baby.
I understand. I understand your concern. And about your, yes, I absolutely admit your prior knowledge about premature babies. But things are that uh, if we, yes, the course is prolonged. undoubtedly, because you can understand that 26-week baby. But at the same time, we can share you the success rate of premature babies with intact survival in our hospital. It's pretty encouraging. I can share you all the details with you. And
Okay.
we have very, at the same time, we have very highly specialized and the newborn team as well, who are monitoring, which included very qualified nurses as well, doctors. So at the same time, we can not, that scenario is not uh, absolutely blunt. We can try our best. Yes, I can appreciate that, and I absolutely uh, sharing with you that we have some of the, you know uh, you know the outcome in some of the cases. We see that there is some issues like developmental related issue, which we can take care in future. But presently, we can give our best to survive the child. Are you with me, Mr.
Yes, doctor.
Kakbright?
Yeah, 3 minutes remaining. 3 minutes. Yes, doctor, I'm with you,
Okay.
but like still you are
Mm,
saying that they will
mm,
have problem with development, and then even if everything goes well, then still we will be having to
mm,
follow up with you
mm,
in the clinic,
mm,
and they will still like they will have many chance of getting infection more easily than
mm,
the baby who are born on
mm.
time. So even
Yes.
if everything goes well, still there will be problem. What I have understand from your discussion.
Mm, mm, mm. Yes. So, yes, the course is pretty long, and uh, very soon I'm going to fix one meeting with my senior consultant with you, that both of you can discuss and share, and I think you will be more ease regarding this particular scenario. So, and one more thing, I can share you one support group that we have, that they have with premature baby who deliver, who are doing very well. So basically, we can share you the number. We can share you
Okay.
the contact as well. So you can go with them. And at the same time, I can provide you some of the good literature regarding the how they are doing very well with appropriate care. Are you with me, Mr. Kirkbright?
Yes, yes, doctor, I'm following. Yes, yeah, I'm following with you. Yeah.
So, at this particular moment, I just want to know any other concern that you would like to share with me.
No, that's fine, doctor. We'll give it a second thought. I will just, me and my partner will
Okay,
think about it. And as you said, you will arrange another meeting with your senior consultant.
okay.
So,
Mm,
well, we will
mm,
have second thought for it, and then the second discussion, we will come out with some final decision.
okay. That's great, Mr. Kirkbright. I wish uh, all the best. And at the same time, I'm just quickly summarize today's discussion, that
Okay.
it's unfortunate that Mrs. Kirkbride is on labor and very if she is about to deliver a very early baby, but at the same time she is having some of the good medicine that can help surviving the child with intact survival of the child. So
Mm-hmm.
for that purpose, at that time, we just hope for the best of the child. The child needs some ICU setup for long time, though there are some restriction, there are some life limiting condition that we may face, but we will handle it with our highly professional team. So I wish all the best to both of you, and if any help you would like to contact with
Thank you so much. Thank you.
personally with me. Thank you very much.
Thank you.
Thank you.
Okay. 5 second remaining, almost finished. No problem. Okay.
Okay.
Yes. So,
Okay.
yeah, how you did? What's your thoughts? What's your belief? It was a
Uh,
difficult scenario.
there's so many things to say.
Yeah,
I think, and at the same time, convincing parents
it's
that
the
the
most difficult
child may
thing.
have difficult
Yeah, especially like it is
things.
a
Yes.
major decision.
So
Even convincing them for vitamin
yeah.
K is the most difficult thing. Like a simple
Yes.
injection, when parents they make their mind that they are not taking vitamin K, so it
Yeah.
is like you'll spend hour with them, and in the end they will say no, I don't want. So yeah, it is
I
very
don't.
difficult. Yeah,
Mm,
convince someone once they have made their mind and they have read many bad thing on the internet, especially Google.
mm,
You don't know
mm,
where Google is taking them. It is
exactly.
authentic source. It is like someone like vague story someone has put on the Google and they are reading about it, that preterm baby this.
Mm,
So you generally did good. You should have like speaking a bit more broad, and like don't focus on we. So you should have told that there is a big study which has been done, and the survival
mm,
rate from the 26 week is very good. We can see that
mm,
2 out of 10 baby who are born at this gestation. If you don't know the figure, no need to give the figure, but you can see that generally we have
mm,
seen that most of the baby nowadays with advance in the treatment and advance in the care level of care
mm,
which is provided at
mm,
this level, these babies are
mm,
doing quite well. The survival rate is good, and also they have less chances of getting disability, although there is some chance that they might have complication in future. But due to recent
mm,
advances in the care level of care and all these setups, these babies we are seeing that they are doing quite well nowadays. In the future, even we are following them regularly for development, and we see that
mm.
they are doing very good in development as well.
Very good.
Yeah, and
Okay.
especially like as she was concerned about the CP, so you can like you said, she is taking on magnesium sulfate. So as you are taking
Mm,
magnesium sulfate, so there is some prediction that magnesium sulfate can help can protect the
mm.
brain, and
Brain.
they might have less chance of getting to
Mm,
be CP in future. There is one very
mm.
good BAPM I will share. Yes, so this is the normally if we are going to any parents, we usually take this paper with us if it is between 20-26 week to give them a leaflet in the end. You can see this
Okay.
one, yeah. You can see the screen, yes.
Mm,
Yeah. So if you see a 26 week especially, so 2 in 10 babies they dies and 8 in 10 babies they are survive. And disability also, it is just 1 in 10 babies have severe disability while 9 in 10 they don't have. So survival, especially at 26 week, is very good. But still, in the end, it will be decision of the parents. Like I will
mm.
give you an
Correct.
example. Recently, we had 2 babies. They were extreme preterm, and both had grade 4 IVH.
Mm,
And we gave option to the parents for withdrawal of care because their ventricles were dilating and the ventricular index
mm,
was continuously increasing. So we
mm,
discussed with our pediatric neurology team here in London, and they advised that if they want us, we can ship the babies to them, and they will do the procedure. So we gave the parents the option that whether they want to go with withdrawal of care or they want to continue the care. So one of the parents they agreed for withdrawal of care, but the other
mm,
parents they didn't agree, and we shipped the baby to London for higher care, and they did a V patient, and still the baby is there, and most probably he will be CP. So in the end, it's
mm,
decision of the parents. Like they have to
mm,
decide what they want to do. But ethically, it's our duty to tell them what's good for the
mm,
baby and what can happen. Like if it's a 22 weeker or 23 weeker, and if these parents are insisting, I will definitely tell the parent that okay, let's give the baby a comfort care. But if it's a
mm,
26 weeker, we have to involve even consultant, and if not satisfied by one consultant, we can bring another consultant. But looking at the
mm,
survival and disability, we have to consult that parent that the outcome is very good. We cannot let the
mm.
baby just die like this and give the baby comfort
Exactly.
care. Yeah.
Mm,
So if it is like coming down like coming to 22 and 23 weeker, we might go with them. But if it's like 24 and 25 nowadays, like these babies are doing quite well, especially like
mm,
the ventilation is quite well now, not like before, like
mm,
they were just ventilating the baby, keeping the baby intubated, and for a longer time, most baby will end up in chronic lung disease. But nowadays, the
mm,
ventilation is quite good. Like
mm,
I see that within 3 to 4 days, sometimes the 24 weeker or 25 weeker, they are extubated. Like yesterday, I
mm,
had delivery with me, twins delivery. They were 27 weeks
mm,
and both of them are CPAP, bubble CPAP, and they are doing quite well. But in the past, they used to be intubated. Like any baby preterm, it was a concept that let's intubate the baby.
mm,
Yeah, so you did generally very well. Try not to talk more about we, talk about in general. Like
mm,
you can tell them like looking at the figures, we can see that yeah, these babies
mm,
nowadays they are doing very well. And there's a larger study done on a lot of babies, and the data has been published, and I will give you the leaflet as well, in which you can see
mm,
that especially your baby, as you are at 26 week and you have taken steroids and you are on magnesium sulfate, so these baby are generally
mm,
doing quite well.
mm.
Yeah.
Okay.
Okay,
Okay.
any question, any
Thank you.
worry?
So just about if the child is, as you mentioned, that if the child is in 22 or 23 week and parents insisting, what could be my throwing from my part? What could be the throwing? Okay, I know that, but ethics come in between. That
Yeah, so if it is 22 and 23 weaker, you can still offer them that let's give a chance to the baby. We will see how the baby will perform once the baby is born. If the baby
mm,
is crying and the baby is breathing, then let us
mm,
give her the opportunity to proceed with what we normally do for these babies.
mm,
So at that time, you have to give them the option that let's decide once the baby is born.
okay,
Yeah. So if the baby is crying, baby is breathing, so let's proceed with intubation and admit the baby. But if you think the baby is totally flat, there is he doesn't have any heartbeat, he's not having any
mm,
breathing efforts, so in that case, if you are doing a resuscitation under 22 and 23 weaker, so putting all the pressure, you are damaging the lungs, you are increasing the pressure in the brain, so in the end he will end up in a lot of complication. So in
correct.
that case, you can just tell them, let's, yeah, decide once the baby is born, and we will see the baby
Mm,
activity, how the baby is performing. So if in case the baby is breathing, we will proceed with what we normally do it at this gestation. But if in case we see that the baby is not breathing, or baby like heart, we cannot appreciate any heartbeat, then we will let the baby with comfort care.
okay,
Yeah,
great. Okay, thank you.
yeah. Any other question from any other attendee? Yes, so someone asked 26-week active management and registration is offered. Looking at the figures, what the BAPM has been published. So in this case, 26 week, you have to give full effort, even if the parents, they are not agreeing, because these babies are generally doing well, unless and until this baby is born at home and brought to you in severe, like complicated condition, or if the baby is born at lower level NICU where they have tried a lot of time intubation and they are not able to intubate, or they are not able to resuscitate, in that case you can stop. But if in case it's delivering in a good setup and it's a 26 weeker, so definitely we will go with our ethics, because this baby will be doing good in the future. There is a good chance that this baby will be surviving, and there is a good chance this baby will not be having any complications.
Can we say like this thing, let the baby to come and see how the baby responds, how the baby's heart and everything working, then we can decide as of now.
Yes, like as I said earlier, in 22 weeks. So you can tell them also like this. Let's decide once the baby is born, and we will see how the baby is performing. If the baby's heart is beating good, and if the baby is crying, then we will proceed with what we normally do for this babies, these kind of babies. So you can tell them, yes.
And if still the mother is, parents are not agreeing, then actually it's a basically part of the consultant or the mother actually decide if the baby has to be taken care of or not.
So it will be then the combined decision of the consultants. Not only one consultant can decide, one consultant
Mhm.
has to go, and then the other consultant can go and talk to the parents. And if still the parents are not agreeing for resuscitation, and we are sure that the baby, like they have done a scan for the baby, baby is a good weight, it's a good size baby, and like she has received steroids, she has received magnesium sulfates, and we are hopeful that the baby will be doing well. So it will be combined decision of the consultants. They will be deciding what in which direction they will be proceeding,
Mhm.
especially
Dr.
like
Zahid,
yes,
Dr.
Thank you,
Zahid,
sir.
hello.
yes.
Dr. Zahid, actually in the labor room, in
Mm-hmm.
this situation, there will be few seconds only in our hand to decide. Suppose the baby didn't cry
Mm-hmm.
and 26 weeks.
Yeah.
So whether at that moment the mother, even if the mother is not agreed, we should
Mm-hmm.
go for resuscitation or not.
So it depends if the baby is having heart rate or no. What do you think? And what's in your mind?
If,
Baby
if,
is still.
if the baby is having two options, one option is baby is having heart rate but
Mm-hmm.
extreme
Okay.
bradycardia, not breathing,
Yes.
and one option is there is no breathing, no beat.
Okay. So if there's completely no breathing, baby is completely limp, and like you see that there is little chance that you will do resuscitation and the baby will not make up, then you will go with the what plan you have made with the parents. But if in case there is some heartbeat and you can see there is some
Yeah.
gasping breathing, so then you will proceed with inflation breaths, and you will see how the baby is responding to inflation breath. you give the first set of inflation breath, then you give the second breath of inflation breath, and if you see that with the inflation breath, heartbeat is picking up, his or her respiration is improving, so then you will proceed with the resuscitation.
Even
But
if the mother do not want, that is
if
what
the
I
mother
want
do
to
not, yes, because if you see the baby heart is beating and there is some gasping breathing, and you give inflation breath and the baby responds well to that inflation
Yeah.
breath, then you will proceed with the normal protocol.
Okay.
Yeah.
In
Dr.
that case,
Zahid,
it is our ethics to go ahead with resuscitation, even if the parents are not interested.
Yes, ethically, yes, you can go with it, and you can justify that with this research and all these things, that these babies, they are doing quite well at their gestation, because you have your this ethical decision as well.
Yeah. Thank you.
Yeah.
Dr. Zahid,
Someone,
I have a question regarding
yes.
a very well presentation by every participant. I want to
Hmm.
add a little to it. If the baby is born, we can consult the mother. If the baby is born with a good cry and
Hmm.
with normal ABCs, then we can continue in there. We can handle it a neonatal care unit in the stable hands, and then we won't be. The child will have a better prognosis rather than go for the negative ends.
Sorry, I didn't get your question properly. Sorry, what?
I'm saying with this counseling session, if the mother
Yeah.
is saying 26 weaker is an early one with a lot of complications, we can tell we
Yes.
depending upon the birth. If the birth is stable, good cry, the color of the skin is good, the reflexes are well, then we can keep in observation. The chances are there will be stable hands and the complication will be less. Can we say that to them?
Yes, we can say, like, if baby is born in good condition, so definitely the complication will be less. Yes,
Yeah.
you can say like that. Yes. Uh,
Thank you.
yes. Someone asked any question about surfactant. I think 28 to 32 week. I cannot see the chat box. Oh yeah, 1 minute. Sorry. Newer guideline for administration of surfactant 28 to 32 week. Uh, sorry, if you can explain your question further. You mean for all babies, or what's your question is? Because nowadays, even surfactant, even if it's extreme preterm baby, like just I was giving the example of 27-weeker delivered with us twins yesterday, and they were doing quite well. One of baby in night time had high FR2 requirements, so they gave him a Lisa, while the other twin was still fine on bubble CPAP, and both are 27-weeker, and we didn't give any surfactant. So nowadays, I think surfactant is not given as routinely as it used to be before. I think before, like, if I go 10 years back, any baby, they will below 32 weeks, they will intubate electively and they will give surfactant. But nowadays, I think the trend is changing. But still, I will check for you the newer guideline, what the newer guideline is saying about surfactant between 20 to 32 week, and I can share that in the group as well.
Dr. Zahid,
Yeah.
so even before we go into the delivery, or when the mother goes into the labor, should we give the options that if the child is not breathing with heartbeat and breathing with heartbeat, we have given the stats about the survival rate and the complications, etc. Should we make the parents or prepare for an outcome that if the child is going to be like this, these are these things we would do, or something like that? Should we say even before they ask for it in
No,
a
so
scenario
normally,
like this?
so not like we have made this scenario because the parents, they are not agreeing for registration. Normally, if nowadays any baby that's born after 22 weeks, we are doing full effort for that baby. Like, if the parents like they want on 22 and 22 week 3 week, we might agree with them not to do registration. But like, if this discussion has not started, like the parent has no concern regarding the outcome, so any baby who is born after 22 week, we have to do full registration. This scenario we are just talking in general, because the mother, she is concerned that she think that if baby is preterm, baby will be CP. So that's why we are focusing more at this time about this discussion. But generally, if the parents are not asking any question about registration, then we will be doing our full effort for any baby which is born after 22 weeks.
Okay, thank you so much.
Yeah. Okay, I can go to the next communication. This will be a bit, I think, difficult. Dr. Ashish, you want to do this one?
Yeah, I will do that.
Okay, you can read it, you can prepare. Ready?
Yeah.
Okay. Yeah, we can start. Yes.
Yeah. Good evening.
Good evening.
Yeah. I'm Dr. Ashish Fakta. I'm a registrar in the Department of Pediatrics in this hospital. Hello, Jed.
Hello.
How are you?
I'm good now. I'm fine.
Yeah. I hope you are feeling better now.
Yes, doctor, I'm better than before.
Yeah. Jed, can you please share with me what you are worried about so much? Because what sister said, we have been very worried about this incident. So you can share with me so that I will help you in all respects.
Doctor, I'm fine now. I think I need to go home. I need to sleep. I'm very tired. Please, can you let me go home?
In time, of course, because as you know, you are conscious about that. You have taken some medicine that was for your mother, and you have taken it in a bit extra doses also. It can have some side effects, so we'll have to watch you for some time more. But at the same time, to be very frank, Jed, this incident needs to be shared with your mother also.
What are you
What
talking
is
about, doctor?
I am talking about as we have found by examining you and from the nurse sister, that you have been pregnant right now.
See,
So,
doctor, what is this? What kind
yes,
of is you have? Like, I just shared my secret with her, and she's telling everyone, like, is this the way to talk about someone?
says,
I
yes,
disclosed
Jed,
my
yes,
secret
Jed,
to her. I disclosed my secret to her because I thought she will not share with everyone, and she was so kind to me. But is this the way, like she told you? And I don't know how many other people will be not aware of my condition.
Jed,
You told her that not to tell anyone. Like, doctor, this is not good.
I beg apology for being informed about that, but the
You
thing is
have
that
confidence, doctor.
as
You are.
uh,
I
uh,
trusted
uh,
me.
uh, Jade, the thing is that it is the duty of the nursing staff to inform the thing with the doctor. Because we are treating you, we have to know every details of your illness so that we can serve the best possible treatment to you. But I can assure you, this will not be disclosed to anybody else without your permission.
Yes, doctor. I'm a grown up
Okay?
now. I'm 13-year-old.
Yeah,
I'm a teen.
I
I can take
admit that you are grown
on.
up. Yes.
Yes, so I don't know why like everyone is treating me still I'm like they are treating me like a kid. I'm not a kid anymore.
You're definitely not a kid. You are gradually growing up. I admit that. But the thing is that everything, there are some states' law that we have to follow. As because you definitely have freedom to do, but there are some age limit for doing everything. So at this age, as you have become pregnant, and we have to know what is your opinion about it and what your parents are thinking about it. And you are not required to be scared because whatever we will be doing, we will be doing for your betterment.
Yes, doctor, but
So at least,
I don't want my mother to know about this. I told her clearly. I don't want my mother to know about this thing.
yeah. But the thing is that if we want to help you in this rigor, if we want to help you to get rid out of this, and your parents, particularly your mother, has to be involved. Otherwise, we cannot help you.
She will kill me, doctor. How I will involve her? She will kill me if she come to know about
Uh,
this all these
uh,
things.
no, that's not the fact. We'll inform her in such a way that these things can happen. And for the sake of her daughter, for the
See, doctor,
safety of you,
nurse,
rather,
the nurse informed you, and now you are saying you will inform my mother. I'm not agreeing
no,
with you. I
Jade,
don't want to let.
Jade, Jade, I tell you, uh, for your safety in future, for your safety with this incident, your mother should know. And that is the, I mean, rule. That is the, system over here. Without informing your mother, we cannot let you go home in under these circumstances.
Please, doctor, I beg you, don't tell her, please. Please, doctor.
Yes, Jed, I
Please.
understand the stress that you are going through. I understand you are very much, scared about it. But we will share the information with your mother in such a way that it will not be in any way harmful to you, because they are your parents. They love you. They want to do good to you as we want. So under these circumstances, to proceed with helping you, we have to inform your parents, particularly your mother.
I know, doctor, my mother, she will not understand this thing.
Yeah, but she has to understand, because we will let him, we'll inform her like that. Because you see, first of all, you have to be safe. This pregnancy, you definitely do not want to continue with it. So according to the system of the country, this has to be terminated. In that
Three
case,
minutes,
without the
3 minutes remaining.
yeah, in that case, without the consent of your parents, as because you are below 16 years of age, without the consent of your parents, we cannot go ahead with it. And just think of the consequences if you do not terminate the pregnancy. What will happen later? Your parents will be much more aggrieved. and then the situation will even be worse.
Doctor, you are
So
again
I
making
assume,
you are again making me
please.
feel like I'm just a kid, that you will go to consent from my parents. I told you I'm a grown-up girl.
Yeah,
I can take
yeah, you are
decision.
grown up. You are, yes, you are grown up, but to do some procedure, we need consent from your parents. That is the system over here. It's not that you are not. We are not saying that you are not grown up, but at this age, you cannot give yourself consent about any procedure. There is a law in the state. According to that, your parents, your mother has to give the permission to us to go ahead with it. And we want to just give you relief from this incident so that you can be free again and you can do better in the future.
Okay, doctor, but I'm quite stressed, scared. Like I'm afraid, like what will
So don't
happen.
be stressed. Yeah, we are, whatever we are doing for your betterment. So let me sum up what we have discussed so far, Jed. We'll definitely inform your father, inform your mother. We'll take permission from her, and we will give you relief from this incident because carrying it in future is harmful to you. Am I clear to you?
Yes, yes, doctor. Yes, it's clear. Yeah.
So let us go ahead with it. And this teenager's pregnancy is harmful to you. So we have to give relief to you and go ahead with the process that is suitable for it. Is that okay?
Oh, yes, doctor. That's fine. Yeah.
Yeah. If you want to know about the harmful effects of teenager pregnancy, well, there are some patient information leaflet for this harmful side effects of teenager pregnancy. I can provide it to you and you will go through it later on. Okay?
Okay. Thank you. Thank you.
Okay. Okay. Thank you, Jed.
Thank you so much. Thank you. Yes, Dr. Ashish.
Yeah.
Yes. What do you think? I
Uh,
know
uh,
it was a bit of a strange scenario and a difficult.
yeah, I am looking for your comments.
What about let's see what others saying.
Okay.
In this case, actually, the girl is thinking she's pregnant, but she's not
She's
sure about the pregnancy. One thing
not yet sure.
is
Yes.
very
Yeah.
important. That
Yes.
first of all, actually, if she's thinking she should go for a pregnancy test, a urinary pregnancy test, that
Yes.
actually can be helpful. In this
Yes,
scenario,
that is very
second catch
important.
is in this scenario, second catch is this girl is 12 year and the boy is 20 year.
Yeah.
The
That's
social services has to come into the play.
yes. This
And
thing. Yeah.
and
Ashish, yeah.
yeah,
Forgot. Yes.
and
Yeah.
third thing is this: let the girl to speak to the mother if she turns out to be pregnancy or her sexual relationship with the boy. She's the one actually supposed to tell her parents, and she's the best actually candidate to tell her. If she
Yeah.
didn't
But
tell,
yes.
if she didn't tell, if it's in a better interest of a girl because the boy is 20 and girl is 20, then definitely social services is they are going to play the role and they're the right person to tell everything to the family.
Yes. But looking at this scenario, like she did a suicide because she thought she's pregnant and she was not aware that what fluoxetine will cause to her. So that's why she's ended into the hospital. So by herself, she will not tell the mother, looking at this scenario. So it has you to be jumping in the place, and it will not be alone you that you will be deciding. For in this situation, like as you said, yes, she will have a pregnancy test before the things will go further. And if in case it's confirmed by the pregnancy test, then you will have to inform the obstetrician and you have to involve your consultant and involve your social service. So it will be a group like a multidisciplinary team who will be talking to the parents and to the mother. And like she's 13 years, so although we have to talk to her, but it's not definite that if she will refuse and we will not inform the parent, she is not competent as per the law.
No, it's okay. Yeah, you're right actually. But in case suppose the girl is first of all, the girl should be basically encouraged to tell her parents about the all the sexual relationship and the boy. And if she doesn't, then definitely social service come into the play because there's a big difference of the age gap between this girl and a boy.
Yes, yeah, yeah, this I agree with you. You have to
Dr.
psychologically support
Jahid,
her.
one thing I will say, this is always a case to be informed to the social services. Whatever the girl said, because one thing is just attempted suicide, and second
Yes,
thing, as per the history, there is a huge, big age difference between her and her boyfriend. So this cannot be
boyfriend.
treated as a normal phenomenon.
Normal, yes, yeah.
Okay.
Yes.
So under any circumstances, social service has to be informed and parents has to be informed.
Yes, yeah.
No,
Whatever
if
be
the
there, if it may be that
if
she is not pregnant, she is just fearing
no
it, but she
if
attempted
the
suicide.
girl is suppose if the girl is 14 15 old and her boyfriend is 1 year older, then actually there is no socialism involved. In this case, the girl is
No. In
already
England, in England, it is 16 years old when she
yeah.
can give permission for sexual contact. Before 16, she cannot.
Yes, in this the age
I think
difference is
so.
yeah. Yes, the age
No,
difference is
any
quite a
gilly
No,
competent can
the
have
age
sex.
is
I don't
13,
think
yes. Yes, the age is
age
13,
basically
but
doesn't exactly. A gilly competent can have sex. What I know. He's gilly competent. More than 13 years, he's gilly competent. I think.
yeah,
I mean,
yeah,
I do
yeah,
What
not
I'm
yeah,
know,
yeah.
Dr.
saying,
Zahid
sexuality,
can
I
same
say
I'm
it
don't
But
think.
better.
here the
the
difference,
same I'm
the age of
saying.
difference, he is adult. So here I think we have to inform social service.
Yes,
Exactly.
Yeah,
Few of the
absolutely.
teams need to be
either,
involved.
yes,
Exactly. Few of the
either she
teams
is
need to be
pregnant
involved.
or not.
Okay, Dr. Zahid,
Yeah.
one thing would you please make clear? So far as
Yeah.
I know, in UK,
Yes.
law says before the age of 16, you cannot give consent for sex. In that case, if someone more than 5 years senior to you, I mean senior to the girl, does sex with someone who is less than 16 years of age, it will be treated as sexual abuse.
Yeah.
Yes.
Is that
Yeah, so
right or
that
not?
yes, you are right. I don't know who said 13 is the Gaelic competence. It is not 13, it's 16.
16, yes, that's I know.
Yeah, 16. I don't I'm not aware
16
about.
is 16 is basically for the consent.
Okay. And
Yeah,
for
consent
adult,
for sex.
yeah,
No,
and
consent
adult,
for the medical treatment.
yeah, adult here is
Suppose a
considered
13-year-old, sir, just a minute. Suppose 13-year-old girl come to you next morning and she had
Mhm.
unprotected sex and she's asking contraceptives. What will do? And she had a sex with a 14-year-old boy, or maybe the
Yes,
same
so
age group.
No,
That will not be entertained.
not the same scenario, different scenario.
it's different. This is a totally different
No,
scenario.
it's
I
not
tell you
different.
one
Is
thing.
this?
You can give permission for treatment after 14 years of age. You can give permission for sex after 16 years of age. These two things are different. You can give a doctor will ask you whether I'll give you the injection or not. That permission a girl can give after 14 years of age. And before 14 years of age, the parents will give the permission. But for sex, it is always 16 years. Below 16 years, no sex is accepted as permitted sex or mutual consent sex.
Okay. So looking at this one, like she's 13-year-old and her safety is compromised. Her and her boyfriend age difference is quite significant. 7 years is quite significant age difference, which is compared especially in UK. If like she's a boyfriend of 13 versus 14 or 15, that's still acceptable. But she's having a boyfriend which is 20 years old, who is an adult by UK law. 20-year-old can get anything he want. He can get alcohol, he can get cigarette, and we don't know what he is giving to Jade. So in what circumstances this relation is going on. So in this situation, we have to inform social services and we have to inform the parents whether she agree or she is not agreeing. And you cannot let her go from hospital even if she is completely fit. She will have a complete examination. She will have a test for the pregnancy. And then if in case we think she's pregnant, then we will be involving our obstetric team. We will be involving our consultant. We will be involving our social services. And it will be a multidisciplinary team meeting, and she will need a good psychological support. She will be encouraged to talk to her mother first before you start disclosing to her mother. If she's get a good psychological support and she agrees to tell to her mother, then your role will be much less than if she refused to talk to her mother. Okay.
Okay.
Yeah. Yes, so Dr. Ashish, you totally forgot about the boyfriend, which was significantly
Yeah.
important. This is not an easy scenario, definitely I agree. And I took this scenario from the Royal College website. If you go to their ethics portion, this scenario they have formulated specially for the consultant who are newly appointed, and they do this communication scenario with these consultant, like when they have interview for the consultant positions. So they are doing this scenario. So it's not like an easy go scenario. It is a difficult one.
So what about the boyfriend? How should we discuss the issue regarding boyfriend?
So you have to encourage her. Like ideally, she should not be with this boyfriend because the age difference is more. Like as I mentioned, her boyfriend is, as per UK law, he's an adult. He can get anything he want. Like he's allowed to get
Yeah.
he can get alcohol, and he might be giving that to Jade as well. So apart
So
from
I have to
like
discourage. I have to discourage her.
you have to discourage her, yes, and you have to
Yes.
encourage her to tell her mom about the boyfriend as well.
Okay.
Yeah, he might be like exploiting her by giving her all these things which are not allowed for her age legally.
Yeah, exactly.
Yes.
Is there any specific age difference specified by the government in UK?
No, there is no any specific age difference, like, but I think age group of 1 or 2 year will be fine. But I think, but I will search for you if there is any specific age difference, which but I'm not
Okay.
especially aware, yeah, if there is any special or no, which has been specified.
Yeah.
So once her pregnancy is confirmed, or if you are like dealing her with pregnancy related, then she will have all the virology screen, and then if you think that she need, then you might refer her to sexual development, sorry, this sexual clinic, sexual transmitted disease clinic.
Yeah.
Yeah, so this is just a brief thing about consent. I will just close this. Sometime also when we are doing ethics scenario and we are talking about consent, so we don't know in what state the patient or the person who you are talking to is. So for consent to be valid, they must be in fully oriented. They must be full aware of what you are talking to them. So you have to understand that if they are understanding what you are telling them or not. So in this scenario, like she had done suicide, she might not have yet recovered from her normal mental status. She might be still in. She's might like she is tearful, so she's still depressed. So even if she, in this case, she's like 16 year, still I will be at least going to involve her mother, because we don't know what her mental status currently is, and we are not sure if you discharge her thinking that she is gaelic competence and she can take her decision, and next day she jump from the third or fourth floor and she dies. It will be your responsibility because you are the one who discharged her from the hospital. So ethically, you have to decide that what you think is right. And in this scenario, especially, try to involve your consultant always, because they are not easy go things. They might turn up in the court later in the future. Uh,
Yes.
Yes, documentation. I think if it is for adult, the legal age limit for a document to be valid is 6 or 7 years for adult. I'm not quite sure about adult, but it is, I think, 6 or 7 years for a document to be legal and can be opened in a court. Like if you write something now, and within 6 to 7 years an adult complain against you, so that document is still legal. But for a child, like if I am dealing with a newborn and I document something, and after 21 years of age, this child still go to the court, that document is valid.
Yes.
So he's 13 now, but if in case later on she goes and complain against you, so it will be still a valid thing. So documentation and keeping yourself safe by informing the consultant. I will share these links in the 1 minute. I don't know. So I don't know if you can see the screen or no.
Yeah, you can see.
Yes,
So
we
this,
can see.
yeah,
Can you
people
share it on? Can you share it
yeah,
on the
I can share. Yeah, you can
group?
read it. So like people age 16 or over are entitled to consent to their own treatment. This can be only our rule in exceptional circumstances. Like adult, young people are presumed to have sufficient capacity to decide on their own medical treatment unless there is significant evidence to suggest otherwise. I will share this one, and it will clear your further worries as well. Okay, so I don't know who was the third volunteer for us for the.
Me, I think me. But I'm not good in communication, but I'll try.
In this kind of communication, like no one is good. This is like a two-way discussion, especially now it's like a difficult colleague. So it is, I think, a bit easier than the ethics one.
Mhm.
You can see the screen, yes?
Yes,
I can start your time if you want.
but I want to read.
Yeah, you can take your time.
Okay, let's start.
Yeah, okay.
Good morning.
Good morning.
I'm Dr. Raja, your colleague that working in hospital with you, Michael. How are
Yes,
you?
doctor. I know you. How are you, doctor?
How are you? Hope you are fine, Michael.
Yes, doctor, I'm good. I'm good. I'm enjoying.
Yeah. Recently, we were work together for last 3 months, right?
Yes, doctor. Yeah, it's my rotation. This rotation started 3 months back, so it's almost 3 months I'm working here.
Yeah. Really, everyone talk about you in good. that you are decent in your work, and you come work early, and you are doing your job perfect, Michael.
Really, doctor? I thought they don't like me because last time the nurse I was working with and I asked her for something and she made her some bad faces. I thought they don't like me a lot.
Actually, no, we all a colleague. We are all supporting each other, Michael. But I have to talk with you with some issue because we are colleague and we have to support each other.
Okay, is something.
Have you
What?
any background about this issue?
No, doctor, I'm not sure. Like you said, I'm quite good. I come
Yeah,
early, so I don't know.
yes.
Is anyone
But
complained against me or what?
the last few days, it was noticed that you are come lately, Michael.
Okay.
Maybe you have some family issue. We can help you. We are all taking care. We are working together. We are team worker, Michael.
Yes, doctor, like I'm coming on time. I don't know if you are just liking this. Yesterday only I came a bit late because it was raining and the buses got late. So it might be that's reason that only once they noticed me coming late and they started complaining against me, which is really bad.
Yes, sure. I'm so sorry that what happened with you yesterday, but it was noticed that in last few days ago, not just yesterday, you are coming late.
Really,
Is there
doctor?
anything? Is there anything to help you?
No, doctor. Like I'm always trying to come on time, and I don't know who
Yes,
is complaining against me. Can you tell me who complained against me so that I can talk to them and I can discuss with them this issue further?
Michael, I'm not in position to tell you about anybody, but here I'm as a colleague talking with you. If there is anything we can share together and we can try to fix it up.
Yes, like doctor, I'm using public transport, so sometime it might be late. So it is like sometime I might be late 4 or 5 minutes, but I don't know why they are making an issue of just few minutes I'm late.
Yes, Michael, maybe this morning time is not difficult to come. Maybe I can talk with our senior that make another shift for you to come.
No, doctor, please don't inform the senior. Like it's not a
I
very
will
big
not.
issue.
I here with you to fix this problem together, me and you. And I'm the person I can talk with you with the senior to change your shift so you can come early and you can avoid to come late if this shift is not suit you.
No, doctor, it's fine. Like, our shifts are always rotating. So, I love coming in the morning as well because they are around and there is a lot of learning from the rounds. So, I like
Yeah.
coming in morning, but sometimes, like, I'm a human and I don't have my own car. Like, my salary is less. I cannot afford a car, so I have to use public transport. So, I might be get a few minutes late. So, I think everyone has to understand this thing as well.
Yes. Uh, maybe we can talk with the senior and to use the hospital transportation that you can fix this problem.
It's possible, doctor. There is hospital transportation. I was not aware of. It will be much easier for me if I get hospital transport.
Yes, the our goal here to feel you are comfortable to working with us, and if you have like this problem, we can solve it with our senior, Michael. I
This
don't
is doc-
want this simple issue that affect your work and your work.
yes, doctor.
Yeah.
But you are, yeah. One side you are saying you are supporting me, and then again you are saying to discuss with the senior. So now I'm getting scared that
No,
I.
I will go with you and talk with you with the senior, and I will tell him how you are strict with your work and how is your work is perfect, Michael.
Yes, because I'm
And
afraid.
I don't know, maybe you and me to come with to talk with the senior it's better. Maybe other than us to already tell him about this issue. It's better to talk it with me about this issue, you and me with the senior. Am I right?
Yes, yes, you are right, doctor. But if it will go to my education supervisor, he might report me to the clinical lead, and then the things may get worse. And 3 minutes remaining, and it may
Yeah,
get worse. Go to the GMC, and they might cancel my registration. Please, if you can give me some chance, I will try to rectify it, and I will try to come on time in the future.
yeah. Okay, good to hear that, Michael. Michael, let's wrap up what we talked about. We talked about you are recently come late at work, and we will discuss this issue with our senior, and maybe it can offer you the hospital transportation to overcome this problem.
Okay, doctor, that will be much great if there is any hospital transportation because it will be really supportive.
Yeah, okay, good to hear that, Michael.
Thank you so much.
Okay, thank you for your time, Michael.
Thank you.
You are welcome.
Okay.
I tried to not to judge you.
Okay, so yes, like initially you told him you are coming early, and then you told him you are coming late. So, like you should have,
At first he come
yeah,
early,
yes.
and but
So,
at last few days he is coming late.
yeah. So if something is not mentioned in the scenario, try not to talk about that. Like you should
Uh,
have talked to him, like Michael, if you have a couple of minutes, do you mind if I
because
have a
more
couple?
recently it has been noted about
Yeah. Yeah, so don't judge anything if it's not in the scenario. If it's written in the scenario, then it's okay. But if not, then try not to judge. So you should have like started like, Michael, do you mind to have a cup of tea and we will discuss some important issue? Then I would have asked you everything okay. So then you should have told that a concern has been raised from some member of the team or member of the staff that they have noticed that you are coming a bit late nowadays. So is it everything okay with you, Michael? So you should have then asked like this. So
Mm,
don't tell anything if it's not in the scenario. Second thing, yeah, you did very right. You try to understand the situation, what actually the situation is. You need to reach the situation. Like his problem is transportation. But second thing, in NHS there is no transport system. So don't offer
yeah.
any transport to anyone. Yeah, yes. You can
Okay.
encourage him to buy a bike. And yes, there is a cycle scheme through NHS. He can buy a cycle with easy installment. This you can give an option to him, but he can.
Mhm,
Yeah, there is no transport system, so like not to promise anything which is not in our power. Like even the consultant, they cannot do anything because transport is a separate department in NHS. So yeah, don't tell them like this. So situation you came to know about his situation, that his problem is transportation. So you can tell him if he can take an early bus if in case he's worried that the transport may get late, or if he's missing the bus, or there is any change in the schedule. So try to come, wake up a bit early and try to take an early bus if in case there's missed. So he will be ready for the next one and he will reach hospital on time. So if in case you think that is couple of minutes that he's coming late, so it's not couple of minutes. The second thing is patient safety, which is compromised in this condition. If he's repeatedly coming late, so he will miss the handover, which is an important thing. We know what has happened in the last 24 hour or last 12 hour in the shift. So if he's repeatedly coming late, even 5 or 6 minutes, he is missing the important bit, which is the patient handover, and he might not be aware of a sick patient, which was just discussed today in the morning meeting. So patient safety is compromised. So this is also you have to discuss with him. And like if in case like you think that you tried and it has not worked, so then you have to raise this thing to the education supervisor. Here everyone has education supervisor. Like in our country there used to be consultant, but here we have a named education supervisor. So if I have any problem, or I'm making problem, I'm doing something which is not right, so any consultant who thinks that I'm not good or there is some problem with me, they will discuss the thing with my education supervisor, because he is the named consultant for me. So
mhm,
that education supervisor will then ask me to come and have a meeting with him, and then he will again try to see what actually the problem is before he will raise the concern to the clinical lead, which is the head of department.
mhm.
So things yeah, we'll go stepwise. Like you are registrar, so you try to solve the problem. But if you think that you talk to him and still you think that he will not give up with this and he will keep on coming late, then it's your responsibility to inform his education supervisor. Because now maybe he's a bit 5 or 10 minutes late. In future, he might not come for the shift and he has to release someone and it's a weekend. And already things have been escalated to you, but you ignored them and you didn't inform someone. So then the things will come on your head that why you didn't inform anyone at that time. If you are aware that he's not coming on time.
Yeah. Doctor, really, it's so new. It's new
Yeah, it's
for me,
definitely.
this scenario. Yeah.
Yeah.
And
So
I don't know about these rules even.
yeah, so see, this is the steps you have to follow, like seek information. So you have to seek information what actually situation is. Second thing, the most important is patient safety. Third is initiative, what initiative you took. So in this case, you offered him a transport which is not available.
Mm.
Okay, so yeah, so you will have to take some initiative, like in general, like if apart from this, if if someone is having problem with medical related, like he's not good in cannula, he's not good in any procedure, so then you will offer him some initiative, like let's try on some dummies, let's try this under supervision, so that we will be sure that you are confident enough that next time when you perform independently and you do it successfully, so you have to offer some initiative. But if you think that after these three steps still the things are not working, then you have to escalate to the seniors. And then
Yeah.
in the last it's come the support. I think I have an, it's called spice. Yeah, so these are the things you need to do.
Yeah.
I can share this picture as well in the group.
Okay. Thank you.
Yeah, so you have in any situation it's difficult when once you are talking to your senior. Like with junior it's still easy, but once you are talking to the senior, then the things are much difficult, because then you have to be polite and you have to respect him. And I don't know, some such scenario like consultant level scenarios will not come for you, like a drunken consultant has come to you and you have to talk to him. It is very difficult for MRCPCH level. But if you are applying for training post, ST3 pediatric training, then such scenario will come for you, and definitely they will put one scenario like this, because this is one of the main communication scenario they put in the interviews for the training.
Mhm.
Yeah.
Mm.
Okay.
Okay.
Any
Thank you.
question or any worry from anyone? Mm. Okay.
You- Can you please repeat the order in which we have to escalate the problem?
Yeah, so it is seek information first. Second is patient safety. Third is initiative. Fourth is escalate. And fifth is support. I can share this in group, no problem. Don't I have this screenshot? I can share this picture in the group.
After talking with the colleague, if we have to inform registrar and then who we have to inform?
You are the registrar. Then the next is education supervisor. Like here, all the doctors, like registrars and SHO, the junior doctors, they have a named consultant who is responsible for their performance and everything. Like if any complaint will go, it will go to the education supervisor, and then education supervisor will communicate with the doctor, the junior doctor. Or if there is any appreciation, the consultants are happy, the consultant will tell the education supervisor, and then the education supervisor will tell the uh, junior doctor. Or if the nurses they have any problem, still they will if they inform any consultant, that consultant again will go to the education supervisor. So you are responsible is your education supervisor, who is going to talk to you about any issues that you need to solve, or if he is happy with your performance. So all things will come to you through your education supervisor.
Thank you so much.
Yeah. Yes, and then
Uh,
there is clinical lead, which is head of department. There is one clinical supervisor, but that's specifically for the training, so I will not talk about that. Clinical supervisor, it is the same what we have in in Pakistan, India, in Bangladesh, I think the supervisor who remain for us for the whole training period. So clinical supervisor is the one who will be responsible during the training period, but that is not for us. So education supervisor and clinical lead are the two things which are responsible for us.
Uh,
Yeah.
Doctor, just a question. But in this scenario, we'll not be discussing about escalating to educational supervisor or clinical lead. Should we mention that to the trainee who we are speaking to in this scenario?
Yes, so in this scenario, yeah, you have to tell him that if he's coming repeatedly late, then the things will have to be escalated to the education supervisor. So
Okay,
you
so
will give him a chance, yeah. But if in case you have to tell him that if in case further any complaint came against you, then the things will have to be escalated to the education supervisor. As you are talking to him for the first time, so you can give him a chance, and then if the another complaint came, then you have to go to the education supervisor.
okay, so it will be like we have to warn him priorly before
Yes,
escalating.
yes,
Okay,
yeah,
thank
no.
But when he said to me that I'm scared to talk with him and he will penalize me about this.
Well,
My
then,
answer was right.
so he has like, see, if he's scared, then either he has to make the things right, he has to come on time, or if he's scared and he's not making the things right, then the things will go to the education supervisor. Yes, you told him that you will accompany him to the consultant and you will discuss with him. That's also right, because you want to solve his problem, like you wanted to arrange a transport for him. So in that case, yes, you can take him with you if he agrees that okay, let's go to the consultant and let's discuss if they can arrange the transport for him. In that situation, he is talking to you the correct problem which he's facing the transport. Sometime the problem will be something else, but they will be just making it like, oh, I have problem with transport, but we don't know, maybe he has drunk overnight and he didn't wake up on time, or he is like person who cannot wake up early on time and he's missing the bus like due to his mistake, not due to the transport problem. So
Mhm.
yes, in that, yeah, but if he's just making the problem is something else, and he's just telling you the transport issue because he don't have any other way to escape from you.
Yeah.
Yeah. Okay. I think the last scenario, I think it was Dr.
It's me.
It's you. Okay.
Yes.
So for you now, it is a
My
bit difficult again because you are talking to the senior.
okay. Just 1 minute to read the scenario.
I will take your time. You take your time. I will.
I'm ready.
Okay, you can start then.
Hello, Dr. Darren.
Hi, Dr. Zahra, how are you?
Thank you. Dr. Darren, thank you for your time, which I know you are really busy, and I'm really grateful that you give your time to me, and it's really important for me to speak to you. So I apologize for taking your time, but it's a really important issue for me. So I really like to speak to you.
Yes, okay. Everything okay with you, Dr. Zahra?
Actually, not everything. You know, I'm a registrar, and my knowledge is really not mm, that kind which I can handle all the patient, and I really need your help. And you always done that, but sometimes, as you know, which our hospital is really busy, and there are lots of patients, and I really haven't enough knowledge to handle all the patients. I really need your help, and I know when you
You're not,
answer the belief, you
yeah, but we have guidelines everywhere. Why you're not following the guidelines?
actually I have done always. I go to the guideline, but sometimes it's a little hard for me. For example, I couldn't understand the exact disease. I don't know which guideline should I go through it, and sometimes the patient is really in a hard situation, and I really need your help. I think it's for the best interest of the patient and the safety of the patient, which if you can help me. So
Yes,
I need, if it's possible, you can please answer my belief, because the general hospital is really busy, and I really need your help. So
yes, doctor. I don't know, Dr. Zahra, this bleep is getting like crazy. I don't know. I changed the battery. I think the battery was giving me problem. So that might be the reason that I didn't answer the bleep. But always answering the bleep.
yes, I know, and I think sometimes your belief is the batteries is flat. So if you can just charge the batteries or do something about your blips, it will be a great help for me, and I will be really grateful.
Yes, yes, definitely. I will see. I will change the new batteries in it. But if everything is okay with you, you want me to see some patients for you now.
Uh, Actually, not now, but I have problem in my shift, and I want you to know about my problem, because it's sometimes really maybe it sometimes maybe cause a really difficult situation, and it may suffer for patients, because I really need your help. And when I need you, I really uh, be grateful if you can answer me at that time, because you know, sometimes there are emergency, and I need your help at that time.
Yes, definitely. I will always try to be there around you when you need my help. But I don't know. This bleep is like not doing well. I think I have to report this to the IT because this battery is finishing quite quickly, and I think sometimes the signals are dropping. So it is more the problem from the bleep rather than me. Like whenever I get a bleep, I respond to them so promptly. But I think this bleep is not working properly. I think I have to report this to the IT so that they can replace this bleep for us.
Thank you. It will be really good, and it will be really perfect. If you haven't enough time, maybe I can do that for you, and I can go. If you haven't enough time, I can go to the IT and speak about your bleep, because I know that you are really busy.
No,
But
that's
it's
fine. Definitely,
really
I will. Yeah, but I hope you have not discussed this with anyone else.
okay. If you want, I won't. So I was just really insist on repairing your belief, because it's really important for me, and also for the patients.
This is definitely, no, I will do that, Dr. Zahra. I will take it to the IT, but I hope you have not discussed this with someone else. You have not talked to anyone else before talking to me.
Not yet, but as you know, it is about the patient safety. I decided to speak to you at first, and I really hope that it will work, and I haven't problem in my next shift,
Yes,
and
yes,
it will be really.
yeah.
Thank you.
Yeah, I will solve this bleep problem. And if you want to take some break, I'm here. I can take and cover your duty. You can take some rest and take a break, take some tea, and then you can come and join me back in the patients.
Uh, that's you are really kind, but no, I'm in my duty, and I will try to do my best. And at the same time, I learn from you as a senior colleague, and it's really important for me to do my duty, and at the
Really, that's
same time, okay. And at the same time, it's really important to me to have your um, um, suggestion when I don't know what to do with the patient. As your senior, and your knowledge is really important. So I ask you to repair your belief, because it's really important to answer me. I haven't enough knowledge in some case, and sometimes the hospital is really busy, and I really need your help. So I want you to repair your belief, and I didn't want it's at the next shift. And your opinion and your knowledge is really important for me.
Thank you so much, Dr. Zara. I will just go straight away. I will take care of this bleep and I will try to solve this problem. And thanks for escalating this issue to me. And I will try not to let this happen in future.
Okay, thank you. It will be perfect. Thank you.
Thank you. Okay. Yes. So very good, Dr. Zara. Yeah, only thing you should have told him also, like, yeah, I'm afraid that if this thing happen in future, looking at patient safety, I might have to escalate this to the consultant and your education supervisor, because I don't want the patient safety to be compromised.
Yes, yes,
Yes.
I agree. Thank you.
Yeah. So yeah, the someone said keep change the bleep. Yes. So if the bleep is not working, so it has to be changed. But first they check it, and they will do the quality check, and if they think that bleep is a problem with the bleep, then they will change it for you. But in this situation, it is the registrar more than what the bleep problem is, that he's not answering the bleep. So once you warn him, so then he might be a bit careful in the future, because we have daily test calls for our bleeps, like once in the start of the shift, and once around midnight they check our bleeps that they are working properly. So they do a crash bleep test, and then we respond to them that this is my bleep number and it's working. So we have twice a day a bleep check that it's working properly. Different places might have different rules, but this is in my trust where I'm working. So in the end, you have to warn him that I'm afraid that as my knowledge is limited, but if such events happen in future, I might have to escalate this to the consultant or your education supervisor, so that the patient safety will not be compromised. Otherwise, you are quite polite with him, and yeah, it was good.
Thank you.
Yeah. Any question from anyone?
Yeah, Dr. Zahid, should we, as because ST6 is senior to me,
Yes.
so should we tell him that I will be forced to inform the matter to the consultant?
Sorry, I didn't get properly what.
But should I make complaint against him to the consultant, or should I mean escalate the issue to the consultant?
Like first
Is
you have
that
to
the
inform
protocol?
First, you have to inform
Yeah,
him that he's not answering the bleep. So you must be aware that what situation is, like I said, the spice the situation thing in the spice, S in the spice. So you need to know that
yeah,
in what situation he's not answering the bleep. Like I
yeah,
told her that bleep battery is not working or the bleep has some problem, and then
yeah,
I have to make it fixed. So you must be aware of situation. Like before talking to me, if you go direct to the consultant will also ask you, have you talked to the registrar? What was his response?
Okay.
Yes.
And what level this ST6 is? Because it is written there ST6 pediatric training. So
yeah,
if
so
ST6,
sorry,
yes,
yeah.
please. Yeah,
Yeah.
if
So
ST6 is pediatric trainee or he is also at the register level.
So now the system has changed. It was up to ST8. Now it is up to ST7. So up to ST7, they are pediatric trainee and they are registrars. So ST1, ST2, and ST3 normally they are SHOs, and then ST4, ST5, 6, and 7 they are registrar. And after ST7, they become consultants.
Okay. Then this is it is written as trainee over here. That means all
Yeah.
are trainee.
So not all
Other
are
than the
trainee.
consult.
Yeah, no, all of them like they give you this is according to scale salary package. Like my designation, I'm a registrar, I'm a senior clinical fellow, but I'm equivalent to
Yeah.
ST5. So they give me salary according to that because your salary scale change with every ST.
Okay.
If you go from ST3 to ST4, your salary will change. Then if you go to ST5, so every aware of progression, your salary is changing as well.
That means ST6 trainee is senior to a registrar.
No, he is a registrar, but
Oh,
yeah,
he is
in the
also a registrar.
he's also a registrar, yeah, but there can be like someone junior registrar, someone can be senior registrars.
Exactly. I
Yes.
understand. Yeah.
Like someone just freshly jumped from ST3 to ST4, so he will be a new registrar. His knowledge as compared to
Okay.
ST6 is working for last 3 years in training. His knowledge will be more as a registrar as compared to a newly upgraded registrar. Because once you are ST3 and your rotation finish at ST3 and you go to ST4, you like on 31st, I think 30, the rotation there here started 1st of March and 1st of September, if I'm not wrong. So 1st of March, like 28th of February, you will be an SHO.
Yeah.
And the next rotation you will be starting on 1st of March, you will become a registrar. So within one day, you jump from SHO to registrar.
I understand. So
Yeah.
what level is above ST7?
A consultant.
Consultant. Next
Yeah,
to consultant is ST7. Okay.
Yeah, like we finished MRCPCH. Now it previously it was supposed to be finished at ST3, but now after the Progress Plus started, they give you a grace period of 1 more year. So you have to finish MRCPCH by ST4. So once you finish
Okay.
MRCPCH, then you like every year you progress, and after you finish ST7 training, there is no exam or anything here. The only exam they take is MRCPCH. After ST7, then you have to apply for the consultant post, and then you will have interviews with for the consultant post. Whatever your
Yeah.
specialty is, or you are a general pediatrician, then direct if you got post, one day you will finish your registrar training, the next day you will be a consultant.
I understand.
Yeah. Yes. Any question or any worry? Yes, ST1 to ST3 is a junior SHO and then it's registrar. Okay, guys, thank you so much. It was lovely seeing you, and I hope we will arrange other meetings as well. I will say bye now and I will start getting ready for my duty because I have a night duty today. So thank you
Yeah.
so much, everyone.
Thank you so much.
Thank
Can
you,
I ask
Dr.
one
Zahid.
question?
Thank you.
Very
Thank you.
informative. Thanks. Have a calm
Thank you so
shift.
much. Thank you.
Bye.
Welcome. Bye-bye. Bye. Take care.
When is your next meeting?
Yes, I will just see with the people's and then we'll arrange soon. The more you support us, the more meetings we will arrange. But yeah, and it depends on you what meeting you want. Uh, if you guys want development, next we can do development. If you want history, whatever you want, if you can just write in the group, and I'm more than happy to arrange that webinar for you. This was just a surprise one I picked because it was not discussed for a long time with any group. So I thought let's do this one. But if you guys want any specific station, just let us know in the group and I will arrange that.
Thank you so much.
Thank you so much. Take care. Bye. Bye. Good
Thank you,
evening.
lovely.